Many seniors are shocked when they hear this. You can have normal cholesterol and still face serious heart risk. And you can have high cholesterol and not be in immediate danger at all. This is not a mistake. It's because cholesterol numbers were never meant to explain what happens in the aging body. After 60, one cholesterol number can quietly mislead you. And today, I'm going to explain why. Many seniors feel confused when they receive their cholesterol results. Some are told their numbers look normal, yet they feel tired, short of breath, or uneasy about their heart. Others are told their cholesterol is high, but they feel strong, clear-headed, and physically stable. This disconnect creates anxiety. If cholesterol numbers are meant to predict heart risk, why do they so often fail to match? How older adults actually feel? The answer is not that cholesterol testing is useless, and it is not that doctors are ignoring important data. The problem is that cholesterol numbers were never designed to explain what happens inside an aging body. Most cholesterol guidelines were developed decades ago. They were based largely on studies of middle-aged adults, not people in their 70s or 80s. After 60, the body changes in fundamental ways. Blood vessels gradually lose elasticity. Blood flow patterns shift. The nervous system responds differently to stress, movement, and even posture. Because of these changes, the same cholesterol number can mean something very different at 70 than it did at 40. This is why many seniors are quietly misled. When they look at cholesterol results without proper context, doctors who work closely with older adults rarely evaluate cholesterol in isolation. They look at how the entire system is functioning. They observe energy levels, mental clarity, and physical stability. They pay attention to blood pressure patterns, not just single readings. They consider how the body responds throughout the day, not just what appears on a lab report. Cholesterol is only one piece of a much larger picture. When that picture is incomplete, numbers can create fear instead of understanding. This often leads seniors to believe something is wrong when it may not be. Or worse, to feel reassured by normal numbers when important warning signs are being missed. In this video, I will calmly explain why cholesterol numbers can be misleading after 60. We will look at what these numbers can tell you, what they cannot tell you, and how doctors actually interpret them. When protecting senior heart health, this is not about ignoring medical advice. It is not about stopping medication. And it is not about fear. It is about understanding how your body truly works as you age, so you can make calmer, safer, and more informed health decisions. Let's begin by looking at the cholesterol number most seniors focus on first. When seniors open a cholesterol report, most eyes go straight to one number. It is often labeled bad cholesterol. For many years, people were told a simple rule: the lower the LDL, the better. This rule made sense in younger adults. But after 60, the story becomes more complex. LDL is not simply harmful. It plays an important role inside the body. LDL helps build cell membranes. It supports hormone production. It also plays a role in brain function. As the body ages, its priorities change. An LDL level that was ideal at 40 may not carry the same meaning at 70. In many older adults, LDL rises slightly as part of normal aging. This does not automatically mean that arteries are clogging or that the heart is failing. This is why experienced doctors do not react to LDL alone. They look at trends over time. They ask how the patient feels. They observe strength, energy, and mental clarity. Another number, often mentioned, is HDL. HDL is commonly called good cholesterol. For years, higher HDL was thought to be protective, but newer research shows this is not always true. In older adults, some seniors have high HDL and still experience heart problems. Because HDL function can change with age, the number may be high, but the protective activity may be reduced. This surprises many people. It challenges what they were taught earlier in life. It also explains why relying on HDL alone can create false reassurance. Doctors today focus less on labels and more on balance. They evaluate how cholesterol behaves within the aging body, not just how it looks on paper. LDL and HDL are pieces of information. They are not verdicts. When viewed without context, they can quietly mislead seniors. When interpreted carefully, they can support better decisions. In the next section, we will look at another cholesterol number that is often overlooked, yet deeply misunderstood. There is one cholesterol-related number that many seniors either ignore or triglycerides. This number often receives less attention than LDL or HDL, yet it plays a significant role in how doctors assess heart health. In older adults, triglycerides are not cholesterol. They are a form of fat, used by the body for energy. After you eat, triglyceride levels naturally rise. This is a normal process. As we age, the way the body handles energy changes. Metabolism slows, muscle mass decreases, insulin sensitivity may shift. Because of this, triglyceride levels can increase gradually over time, even without obvious disease. Many seniors become alarmed. When they see this number rise, they assume it means their arteries are clogging or their heart is failing. In reality, triglycerides often reflect how the body is responding to daily habits. Poor sleep, chronic stress, and physical inactivity can all raise triglycerides. Dehydration can affect them. Even the timing of a blood test can influence the result. This is why doctors rarely judge triglycerides based on a single reading. They look at patterns. They compare results over months or years. They ask about diet, movement, and sleep quality. A mildly elevated triglyceride level in an older adult does not automatically mean danger. Context matters. Doctors also consider how triglycerides interact with other markers. For example, the ratio between triglycerides and HDL often provides more insight than either number alone. This approach helps explain why two seniors with the same triglyceride level may have very different risk profiles. One may be stable and healthy. The other may require closer monitoring. This difference is not visible on a simple lab report. It comes from understanding the aging body as a whole. Triglycerides are signals. They are not diagnoses. When interpreted carefully, they help doctors identify trends and guide conversations. When viewed without context, they create fear and confusion. In the next section, we will discuss another cholesterol value that often causes unnecessary anxiety in older adults: total cholesterol. Many seniors focus on one number when reviewing their lab results. Total cholesterol. It sounds important. It sounds decisive. But total cholesterol is often one of the most misleading values on the entire report. This is because total cholesterol is not a single measurement. It is a calculation. It combines several components, including LDL, HDL, and a portion of triglycerides. This means total cholesterol can rise for very different reasons. In some seniors, it increases because HDL rises. In others, it increases due to changes in LDL. These situations do not carry the same level of risk, yet they produce the same total number. This is where confusion begins. A total cholesterol value that looks high may not represent danger. At the same time, a normal total cholesterol can hide important problems beneath the surface. Doctors understand this. They rarely make decisions based on total cholesterol alone. Instead, they look at how the individual parts behave. They ask which number changed. They examine trends over time. They consider age, overall health, and symptoms. For older adults, this approach is essential. After 60, the body is no longer operating under the same rules as it did earlier in life. Blood vessels become less flexible. Hormone balance shifts. Energy use changes. All of these factors affect cholesterol behavior. Because of this, total cholesterol loses precision as a risk indicator in seniors. It becomes a broad signal, not a diagnostic tool. Many seniors are told to worry about total cholesterol without being given context. This creates unnecessary stress. Some feel pressured to chase a number that may not reflect real risk. Others feel falsely reassured by a number that appears acceptable. Neither situation is helpful. Doctors aim to reduce fear, not increase it. They use total cholesterol as a starting point, not a conclusion. When interpreted properly, it guides further questions. When interpreted alone, it misleads. Understanding this helps seniors Approach lab results calmly. It shifts the focus from isolated numbers to overall cardiovascular health. In the next section, we will discuss why the idea that lower is always better does not always apply after 60. For many years, seniors were taught one simple message: lower cholesterol is always better. This idea became deeply rooted. It appeared in advertisements, health articles, and even casual conversations. But after 60, this belief begins to break down. The aging body does not operate under the same rules as a younger one. Cholesterol is not only a risk factor, it is also a building material. It supports cell repair. It plays a role in hormone production. It contributes to brain function and nerve signaling. When cholesterol levels drop too low, some seniors begin to notice changes. Energy levels may decline, muscle strength may weaken, cognitive clarity may feel reduced. These experiences are not imaginary. They reflect how cholesterol supports essential systems inside the aging body. Doctors are aware of this balance. They do not aim for the lowest possible number. They aim for stability. They aim for function. They aim for safety. This is why extremely low cholesterol is not always desirable. In older adults, it can increase vulnerability rather than reduce risk. This does not mean high cholesterol should be ignored. It means context matters. Doctors consider how the body is responding, not just what a number shows. They evaluate symptoms. They assess physical strength. They look at mental sharpness. They observe how well the body recovers from daily stress. This approach surprises many seniors. They expect a clear target, but aging requires flexibility. What protects health at 40 may not protect health at 70. This is one reason why some older adults feel worse. After aggressive cholesterol lowering, the body may lose resources it depends on. Doctors adjust treatment based on response, not theory. Balance replaces extremes. Understanding this helps seniors release unnecessary fear. It replaces rigid thinking with informed awareness. In the next section, we will explore another factor that matters more than numbers alone: inflammation. When doctors evaluate heart risk in seniors, they do not look at cholesterol numbers alone. One factor often matters more than people realize: inflammation. Inflammation is the body's natural response to stress, injury, or imbalance. In small amounts, it is protective, but chronic inflammation can quietly damage blood vessels over time. This is where cholesterol becomes misunderstood. Cholesterol itself does not automatically cause harm. Problems arise when cholesterol interacts with inflamed vessel walls. In an inflamed environment, cholesterol particles are more likely to behave aggressively. They can penetrate vessel walls more easily. They can trigger further irritation. This process increases risk, even when cholesterol numbers appear acceptable. At the same time, some seniors have higher cholesterol, but very low inflammation. Their blood vessels remain stable. Their risk may be lower than the numbers suggest. This explains a common mystery: why two people with similar cholesterol levels can have very different outcomes. Inflammation is the difference. Doctors assess inflammation in many indirect ways. They look at blood pressure stability. They consider weight changes. They ask about joint pain, fatigue, and recovery after stress. They also consider lifestyle factors. Poor sleep, chronic stress, and inactivity all increase inflammatory signals. So does persistent emotional tension. This is why managing inflammation often has a greater impact than chasing a single cholesterol target. It shifts the focus from numbers to how the body is functioning overall. For seniors, this approach is especially important. Aging naturally increases baseline inflammation. The goal is not elimination. The goal is balance. Doctors aim to reduce unnecessary strain on blood vessels, not force numbers into narrow ranges. This is also why cholesterol medications are not prescribed blindly. They are considered within the broader inflammatory context. Understanding inflammation helps seniors make sense of confusing lab results. It explains why lifestyle changes sometimes improve heart health, even when cholesterol numbers barely change. And it clarifies why numbers alone never tell the full story. In the next section, we will discuss how doctors decide when cholesterol treatment is truly necessary. and when careful monitoring is enough. Many seniors believe cholesterol treatment decisions are based on one thing: numbers. But this is not how doctors actually work, especially with older adults. Cholesterol medication is never prescribed based on a single lab result. Doctors first look at the whole person. They consider age, overall health, and daily function. They ask how the senior feels during normal activities, walking, climbing stairs, recovering from exertion. They look at blood pressure patterns, not isolated readings. They review medical history, including diabetes, smoking history, and family risk. All of these factors matter more than one cholesterol value. Doctors also evaluate trends. A slow, stable change over several years is very different from a sudden shift. A sudden change may signal stress, illness, or medication effects. This difference is invisible. If you only look at a single test, symptoms are equally important. Chest discomfort, unusual fatigue, shortness of breath, or dizziness change how results are interpreted. In some seniors, cholesterol medication clearly reduces risk. In others, monitoring may be safer than aggressive treatment. Doctors also consider tolerance. Older bodies process medications differently. Side effects matter. Muscle weakness, brain fog, and balance issues can affect quality of life. This is why dosage and necessity are carefully weighed. The goal is not to force cholesterol into a narrow range. The goal is to reduce risk without creating new problems. This balanced approach often surprises seniors. They expect a clear rule, but medicine after 60 requires flexibility. Doctors adjust treatment based on response, not theory. Understanding this process helps seniors feel less anxious about cholesterol decisions. It explains why two people with similar numbers may receive different recommendations. In the next section, we will explore why home cholesterol tests and online charts can easily mislead older adults. Many seniors turn to home tests and online charts to understand their cholesterol. At first, this feels empowering. Numbers appear clear, ranges look simple, answers seem immediate. But this simplicity is also the problem. Most online charts are designed for general populations, not aging bodies. They use fixed cutoffs that ignore how the body changes after 60. A number labeled high may not carry the same meaning in a 70-year-old as it does in a 40-year-old. Home cholesterol tests also have limitations. They provide a snapshot, not a full picture. They cannot account for recent stress, sleep quality, hydration, or illness. Even mild dehydration can change blood concentration and alter results. The timing of the test matters as well. Cholesterol levels can fluctuate throughout the day. They can change after meals, during illness, or following poor sleep. Online charts do not explain these nuances. They treat numbers as fixed truths. Doctors know better. They interpret cholesterol within context. They compare results over time. They consider symptoms and overall function. They ask how the senior feels, not just what the number shows. Another risk of relying on online charts is unnecessary fear. Many seniors see a red warning label and immediately assume danger. This anxiety can raise blood pressure, disrupt sleep, and worsen overall health. Ironically, the stress caused by misinterpretation may be more harmful than the cholesterol level itself. Home tests and charts are not useless. They can be helpful tools when used correctly, but they are not decision makers. They are starting points for conversation, not conclusions. Doctors use numbers as guide, not judgments. Understanding this helps seniors approach information calmly. It reduces the urge to react emotionally to every reading, and it reinforces why medical guidance matters, especially after 60. In the next section, we will discuss what doctors actually watch over time when assessing cholesterol-related risk in older adults. When doctors assess cholesterol risk in older adults, they focus less on single numbers and more on patterns over time. This approach is very different from what many seniors expect. A single lab result does not define risk. Doctors compare results across months and years. They look for sudden changes, not slow shifts. A gradual rise may reflect normal aging. A sudden spike may signal stress, illness, or medication effects. Patterns reveal information that numbers alone cannot. Doctors also watch how the body responds to daily life. They ask whether energy levels are stable. They note changes in endurance, balance, and recovery after activity. They consider sleep quality and emotional stress. These factors influence how cholesterol behaves inside the body. Blood pressure trends also matter. Stable readings over time often indicate resilience. Large fluctuations may signal nervous system strain or vascular stress. Doctors pay attention to how often readings change, not just how high they go. Weight stability is another important signal. Unexpected weight loss or gain can change cholesterol patterns. So can changes in appetite or digestion. Doctors also consider how seniors respond to previous recommendations. Did cholesterol levels stabilize after small adjustments? Did symptoms improve? Or did side effects appear? This feedback guides future decisions. It explains why treatment plans evolve over time. For seniors, this long-term perspective is especially important. Aging is not static. The body adapts continuously. Doctors aim to support this adaptation, not fight it. This is why cholesterol management in seniors is a process, not a one-time decision. Understanding this helps seniors feel less pressure to react immediately to every test result. It replaces urgency with observation, and it builds trust in thoughtful medical care. In the final section, we will bring everything together and review how seniors can approach cholesterol with clarity rather than fear. Let's take a moment to bring everything together. Cholesterol numbers were never meant to be judged in isolation, especially after 60. Lead-to-diesel, cloves, triglycerides, and total cholesterol each provide information, but none of them tell the full story on their own. Aging changes how the body works. Blood vessels become less flexible. The nervous system responds differently to stress and activity. Metabolism shifts. Because of this, cholesterol behaves differently in older adults than it did earlier in life. This is why numbers that once seemed clear can become confusing. Doctors understand this. They do not chase single targets. They look for balance. They focus on how the body functions. From day to day, they pay attention to energy, stability, and mental clarity. They evaluate trends over time, not one test result. They consider inflammation, blood pressure patterns, and overall resilience. This approach reduces unnecessary fear. It helps prevent overreaction to isolated numbers. It also protects seniors from ignoring important warning signs. Cholesterol management after 60 is not about extremes. It is not about forcing numbers as low as possible. It is about supporting the body in a way that maintains strength, clarity, and quality of life. This perspective often feels different from what seniors were taught earlier in life, but it reflects how modern medicine approaches aging. When seniors understand how doctors interpret cholesterol, they feel more confident. They feel less pressure to panic over every lab report, and they are better prepared to have calm, productive conversations with their healthcare providers. This knowledge does not replace medical care. It supports it. By viewing cholesterol as one part of a larger system, seniors can approach heart health with clarity rather than fear. And clarity is one of the most powerful tools for healthy aging. As seniors learn more about cholesterol, many begin to question what they were told in the past. This is because several common myths continue to circulate. One myth is that cholesterol alone causes heart disease. In reality, cholesterol is only one factor among many. Heart disease develops through a combination of inflammation, vascular stress, and long-term imbalance. Another myth is that cholesterol problems always produce symptoms. Many seniors expect clear warning signs, but cholesterol changes are often silent. This is why numbers can feel confusing. A third myth is that cholesterol levels should be identical for everyone. A single ideal number sounds reassuring, but it ignores individual differences, age, genetics, metabolism, and lifestyle all shape cholesterol behavior. Another common belief is that once cholesterol is controlled, risk disappears. But heart health is not static. The body changes over time. New stressors emerge. Sleep patterns shift. Medication responses change. Doctors monitor cholesterol because it evolves, not because it stays fixed. Some seniors also believe that lifestyle changes work instantly. They expect immediate improvements. In reality, cholesterol responds gradually. Small changes accumulate. Doctors look for trends, not quick results. These myths persist because they simplify a complex system. They offer certainty, but not accuracy. Understanding these misconceptions helps seniors release frustration. It replaces rigid thinking with realistic expectations. Doctors focus on progress, not perfection. They aim to reduce overall strain on the cardiovascular system, not to force one number into place. Recognizing myths creates clarity, and clarity supports better long-term decisions. In the final section, we will discuss how seniors can approach cholesterol with confidence, not fear, as part of healthy aging. As we conclude, it is helpful to step back and consider the bigger picture. Cholesterol is not an enemy. It is a natural substance that plays important roles in the aging body. Problems arise when balance is lost, not simply when numbers change. For seniors, confidence comes from understanding, not control. Doctors do not expect perfect numbers. They expect awareness. They look for stability, function, and resilience. Seniors benefit when they focus on how they feel day to day. Energy levels, mental clarity, physical balance. These signals often provide more insight than a single lab result. Regular monitoring matters, but reaction matters more. Calm observation leads to better decisions than panic. Open communication with healthcare providers is essential. Sharing symptoms, concerns, and changes helps doctors interpret results accurately. Cholesterol management is not about comparison. It is not about matching someone else's numbers. It is about supporting your own aging body. This perspective reduces anxiety. It replaces fear with understanding, and it aligns with how modern medicine approaches senior health. When seniors understand how cholesterol fits into the larger system, they feel empowered. They become partners in their care, not passive recipients of numbers and labels. This approach supports healthy aging. It protects quality of life, and it encourages decisions based on clarity, not fear. That is the goal of thoughtful cholesterol care after 60.